cases around the world are on the rise again. China is seeing what looks like to be a third wave of the virus, as Europe is seeing cases starting to rise. What does this mean for the U.S. moving forward? We're happy to have a member of America's frontline doctors here with us to discuss. Dr. Jeffrey Barke, thank you so much for joining us in the Capitol Report.
My pleasure. Thank you for having me.
Now, Doctor, we're seeing what looks like another outbreak in China, a potential third wave. Europe is starting to see cases rise. What might this mean for the rest of the world?
Well, listen, first of all, I don't believe anything that comes out of the Chinese Communist Party in China, so we have to be very skeptical about news and information that comes to us from China. But of course, we expect variants of Delta and variants of Omicron and coronavirus to be present and likely for many, many years. The good news, though, is as each variant comes to be, we hope that it'll be less severe and less detrimental. Plus, so many people now have natural immunity and some vaccine immunity that should be at least partially protective against any variant that comes out.
So clearly the economy cannot sustain another lockdown, let alone the inevitable government money that would come to follow, further exacerbating inflation. The Biden administration knows this as well, which is arguably why they did not lock down during Omicron. What should the government's approach be if we do, in fact, start to see COVID numbers rising in the United States?
It's a great question. First of all, the lockdown should never have occurred to begin with. It was the wrong approach. Studies have shown that the lockdown and the government action on COVID was more detrimental than the virus itself. The proper approach, in my opinion, is the one put forward by the great Barrington Declaration, Jay Bhattacharya and company. And that is an idea of focused protection. We know who this virus harms, and it's not young, healthy people. This virus primarily harms older folks and those with significant comorbidities, underlying illness. Those are the folks we should be protecting and being careful. For the rest of us, we should pretty much go about our business. Many younger people have natural immunity, so they should not worry. Children do great, not just my opinion. If you look at the CDC's own data, less than 18 years old, there's been around 900 deaths over the last 2+ years. Now, while every one of those deaths, of course, is a horrible tragedy, the reality is almost every single one of those deaths in kids less than 18 years old have been in kids that have significant underlying comorbidities. We're talking about childhood cancer, blood disorders, diabetes, obesity, and so forth. Healthy kids simply do not die of COVID-19. They have a greater risk of dying in a traffic accident or from seasonal influenza. So we should be leaving our children alone. We should be not vaccinating them with an experimental vaccine. We should be not masking them. So the approach to COVID in the future should be one based on focused protection, not government intervention, not tyrannical emergency mandates, etc. Those haven't worked. They've done more harm than good.
Doctor, a group of senators just held a press conference on Capitol Hill calling for an end to the federal mandates, specifically mask mandates, when it comes to flying on airplanes. I believe it was Senator Cruz, Senator Wicker, Langford, and Hoeven. And I just wonder if you have any thoughts on masking on planes or masking in general.
Well, absolutely. The science is crystal clear. Masks offer little, if any, protection against a viral respiratory illness. We've known this for decades. Early in the pandemic, every single major healthcare agency told us this. Even Dr. Fauci told us this. The New England Journal of Medicine had a long expose on the lack of efficacy in masking outside a hospital setting. I fly a lot because my kids live far away. When I get on the plane, you'll look left into the cockpit and you'll notice the pilots are not wearing masks. The only people that are mandated to wear masks are the passengers. Recirculated air in the airplane. Are you telling me that the cockpit wall somehow protects the pilots? No, it's theater in the back of the plane. Masks are not effective. They should not be mandated. If an individual person chooses to wear a mask for their own beliefs or their own reason, they should be allowed to do so, but there should not be mandatory masking on airplanes or any other form of public transportation.
Dr. Jeffrey Barke, thank you.
Thanks for having me.